Hey guys, it's Dr. Childs, and today I want to talk a little bit about a thyroid medication called NP Thyroid, and I want to compare it to Armour Thyroid, and then we're going to talk a little bit about what the difference is between these two medications. So first of all, what is NP Thyroid? Well, NP Thyroid is just another type of thyroid medication. It falls in the class of natural desiccated thyroid hormone. It's often a medication that doctors will recommend as the generic version for Armour Thyroid. And so, for instance, the way that a lot of patients are introduced to this medication is when their Armour Thyroid medication price is going up and up and up, and then their doctor recommends something else, or the pharmacy says, hey, we have a cheaper version, why don't you try this? And so some people do, some people don't. And then in addition, recently there's been some difficulty obtaining Thyroid and WP Thyroid, and as a result, patients have been forced to use other types of medication like Armour Thyroid and NP Thyroid. So that's why you may have heard about this medication. So, in other words, in a really simplistic way, it's similar to Armour Thyroid and WP Thyroid and Thyroid in that it is a natural desiccated thyroid. But where these medications differ is in their inactive ingredients. Okay, so they have the same active ingredients, but they have different inactive ingredients. And the active ingredients of any medication, but in thyroid medication, these are the ingredients that do the job that you're looking for the medication to do. Okay, so if in thyroid medication, the active ingredients are the thyroid hormones. That's how it works. And so the active ingredients are the same between these two, but the inactive ingredients are different. And the inactive ingredients, these are the things that just sort of stabilize and bind the active ingredients. They also help with preventing the medication from getting degraded in the stomach or in the intestines, and they protect it a little bit. But the problem is sometimes these inactive ingredients can cause a lot of issues. They can reduce your body's ability to absorb the medication. They can cause symptoms by themselves, so they can complicate how you're feeling when you're taking the medication, and so on. So the inactive ingredients are actually very important. So what I want to do is I want to talk about the list of ingredients in Armour Thyroid and compare that to the list of ingredients in NP Thyroid. Now you'll see if you look around that a lot of people aren't thrilled with NP Thyroid. I think some of that is not necessarily fair, and the reason is a lot of these people are moving from Thyroid and WP Thyroid because they simply can't get it, and they're moving to NP Thyroid. And if you do that, a lot of people are going to be, I think, unhappy with that because it has more inactive ingredients than those other medications, and it's a little different as well. So if you're making the transition from those over to NP, you're probably not going to be super happy. But if you're going from Armour Thyroid to NP, or if you're going from levothyroxine or Synthroid to NP, you're probably going to feel a little bit better. Or if you're just somebody who isn't really sensitive to these inactive ingredients. So, to the list of ingredients in Armour Thyroid, what we have in Armour Thyroid includes Triiodothyronine, which is T3, Thyroxine, which is T4, calcium stearate, Dextrose, Microcrystalline cellulose, sodium starch glycolate, Opadry white, and then also minor amounts of calcitonin, T1, T2, and some other proteins. These are that's involved in the all NDT medications have these. That's just part of the medicine. So you have 1-2 active ingredients and 5 inactive ingredients. Okay, a lot of people who take Armour, they don't do real well. They tend to respond to or react to these 3 ingredients here: the microcrystalline cellulose, the sodium starch, and then the Opadry white. So you can react to these things. Okay, so let's compare that to NP Thyroid. So NP Thyroid has Triiodothyronine, again active ingredient, Thyroxine, again active ingredient, and then it has 4 inactive ingredients. So calcium stearate, again, Dextrose monohydrate. So Armour has Dextrose, and this one has Dextrose monohydrate, Maltodextrin, and then mineral oil. So you can see right away that it doesn't contain the cellulose so Armour Thyroid has cellulose where NP Thyroid does not. So I still think that NP Thyroid is probably a slightly better medication compared to Armour if you are one of those people who are very sensitive to those inactive ingredients. Now, not everyone is, okay? So first of all, you don't necessarily have to worry about this unless you're taking Armour Thyroid or some other medication and you're just not doing well. So let's talk a little bit about cost as well. So this is another one of the benefits and one of the reasons why NP Thyroid might be worth it for you. So the cash price for NP Thyroid, and you can get the cash prices by going to goodrx.com and then typing in your zip code, and it'll formulate and populate some results for you. But basically what this represents is if you don't have insurance, or that So if you type in the name of the medication and it populates, it's giving you the cash price assuming you don't have insurance. So that's another way to say that. So this is a good way to look at quickly the price that you could expect to pay in the worst case scenario. And in the worst case scenario, for 30 tablets of the 60 milligrams of NP thyroid, which is 1 grain, that's about $14.66 per month. Now you'll find also that the prices of different medications can vary wildly depending on which pharmacy is selling it. Remember, pharmacies are businesses, so they'll buy the medication at a lower price and they'll upsell it to you. So some are seriously 3 to 4 times more expensive than other pharmacies. So you got to look around a little bit if you want to do this. It's kind of like gas prices, but a little bit different in that they can differ quite a bit between pharmacies. So cash price, worst case scenario, at least from my area, $14.66 for a 1 month supply. That's not too bad. And if you look at the cash price for Armour Thyroid, it's $26 for the same or equivalent dose. So it's pretty close to about almost half the price of Armour Thyroid, which is very important for some people and something to consider for a lot of you. So anyway, going on here, I want to talk a little bit. Will NP thyroid help with weight loss? I don't think NP thyroid is necessarily better than any of the other NDT medications for weight loss. These medications can all potentially help with weight loss, but this one is not necessarily better than any of the others. It's not like if you're taking Armour Thyroid, you switch to NP, you're suddenly going to get a lot of weight loss. However, if you do switch from Synthroid or levothyroxine to NP thyroid, you might experience some weight loss at that point. And that just has to do with the fact that NP thyroid contains 2 thyroid hormones, including T4 and T3, T3 being the active thyroid hormone, whereas Synthroid and levothyroxine, they contain only T4. So yes, NP thyroid can potentially help some people, but I wouldn't count on it because it depends on how you're getting to this information. If you're somebody who's already on Nature Thyroid or WP thyroid and you just can't find those medicines, then this is probably not going to help you any better than those did. But like I said, if you're on a T4 only, then it might potentially help. So the main difference, not a big difference between these two, by the way. So they have the same active ingredients. One has, I believe it's 5 inactive ingredients. The other one has 4, or is it 6 and 5, something like that. But it's just one slight difference between the two. I think a lot of people, if you can't get Nature Thyroid or WP thyroid, then NP is not a bad alternative, at least temporarily until your pharmacy can get it. I still tend to like NP thyroid over Armour Thyroid, and that has to do with the inactive ingredients, and I think most patients will probably do better. But again, it's up to you, it's up to your body. You have to go through these and look at these. I've had plenty of patients who don't respond to WP but do respond to Nature Thyroid, or don't respond to Armour but do respond to WP, and so on and so forth. So you're going to have to use some trial and error to figure out what works best for you. So that's all I got for you guys today. If you have any questions, leave them below and I'll do my best to answer them. Otherwise, I'll see you guys in the next one.